What is going on, everybody? This is John Haas, RN, CCRN with NRSNG.com, and I am so excited to have you guys here today. I want to tell you really quickly about what happened last month with the podcast. You guys, we hit 2.6 million total downloads for the NRSNG podcast. It blows my mind. Last month alone, we had about 250,000 downloads. 250,000 downloads. That just blows my mind, you guys. I mean, the right word for it is just truly humbled that you guys are finding value in what I'm telling you and the experiences I'm sharing and the experiences that the NRSNG team is sharing with you guys. At one point last month, the podcast reached number 187 in all podcasts. So there's about 450,000 podcasts in iTunes, and NRSNG, little old NRSNG podcast, reached number 187. I'm just truly blown away by that, guys. Thank you so much for listening. Thank you so much for sharing. Thank you so much for your reviews and the messages that you send me. I got messages over Instagram and Snapchat and Facebook this month and through the email about how the podcast has helped you, whether it's given you confidence, whether it's given you a tip, whether it's just been an ear to listen to as you're driving to and from school. You guys, thank you so much. I mean, I don't know how to thank you enough. I want to try something, guys. I want to try something here. I want to try to see if we can reach 3 million downloads before the end of February. So that means we have to get about 400,000 downloads this month. I know that's a huge stretch. I'm going to give away 3 NRSNG Academy memberships if we can reach 3 million downloads. And I want to give that away, and I want to see if we can reach this. I just want to see, let's bring the community together. And the way we get more downloads is if you listen to the podcast, first of all. So listen to the podcast, make sure you subscribe to the podcast, and then make sure you share it with a friend. If there's an episode that helps you, make sure you share it with a friend. So what I want to do, how we're going to do this is, I want you to leave a review in iTunes for the podcast. So you just click in iTunes, leave a review, and then head over to Instagram and post your review on a public post with the hashtag LoveNRSNG podcast. All right, so you'll just leave that review in iTunes, take a screenshot of it, post a picture of that in Instagram with the hashtag LoveNRSNG podcast. And then in the end of February, beginning of March, I'll select 3 of those reviews if we hit the 3 million downloads, and we'll give away the free NRSNG Academy membership. Now, I'll remind you of this throughout the month, and I'll let you know how we're doing throughout the month. But just leave the review, take a picture, hashtag LoveNRSNG podcast on Instagram, and that's all you got to do. So, really excited about today's episode, and let's roll into the show. Okay, for just 1 minute, I want you to close your eyes. I want you to imagine something for me. Now, if you're out driving or if you're running right now, don't close your eyes, but I want you to imagine something for me. I want you to think back to your pre-nursing education days. And think about the tests that you used to get. You know, your tests were, which bone is this? You know, what's the answer to this chemistry equation, etc. So your answers were really always based on correct or incorrect answers. Now, for those of you that are in nursing school now, I want you to try to remember back as much as you can or as best as you can to that first exam you got in fundamentals or that first nursing school exam you got. Now, I don't want you to start having palpitations and sweating and getting diaphoretic and all that, but I want you to think about that frustration you felt when you took that first nursing school exam. So it can't be overstated enough how different nursing exams are from any other exam you've taken in your life. And I try to express this to people. I try to tell this to people that you don't see exams like this, exams that are asking which is the most correct, or what would you do first? Which answer indicates that the patient didn't understand? Okay, you're not used to getting these types of questions. But what nursing schools tried to do and what nursing professors tried to do and what the NCLEX is trying to do is this trying to gauge how well you're able to prioritize important information, important occurrences in your patient. It's trying to understand how well you're able to do that, because as a nurse, we're confronted with A and A prime, right? We're confronted with a patient who's not breathing and a patient who's not circulating, right? And so that's why there's a couple different frameworks that have been designed and that are developed to help you really keep straight how you need to prioritize your patient care. Okay, so what I'm going to do is share with you one nursing test taking tip. You might want to listen to this a couple times to try to keep it straight, but this is going to help you not just in test taking, but this tip is really going to help you in your care as a nurse when you're on the floor, either in clinicals in school or years down the road later on when you are a practicing nurse. All right, now before I say this, though, I want to let you guys know, those that are listening to this on Monday morning when this comes out, that we're doing a webinar. We're doing a live webinar where I'm going to be live talking about 11 nurse test taking tips, or 11 secrets of taking tests in nursing school. Now, if you want to get signed up for that, head over to nrsng.com/webinar01. nrsng.com/webinar01. And Tuesday night, so if you're listening to this when this comes live on February 6th, all right, we're going to be doing this webinar on February 7th, 2017 at 7 p.m. Central Standard Time. So 2/7/17, 7 p.m. I'm going to be doing a live webinar where you can come and you can be a part of that and watch me talk about these 11 steps, these 11 secrets of nursing test taking that are really going to help you. I'm going to have a freebie there. I'm also going to have an offer for the NRSNG Academy. And I really want you to be there. I really want you to see this, because these 11 steps, these 11 secrets that I discovered my first semester of nursing school dramatically changed my experience in nursing school, or at least my experience with nursing school tests. I remember when I discovered these, I stayed up late into the night, probably 2 a.m., on a quote-unquote school night, reading over these and discovering these, and they really helped me. So I want you to take the time. If you head over to nrsng.com/webinar01, you can get signed up for that, and I'd love to have you there, ask questions and take notes, and I promise this is going to be really valuable information that's going to help you. But for now, I'm going to share pieces of one of the most important tips, and this is when we talk about priority questions. Okay, when we talk about priority questions, or when we talk about how to prioritize our care as a nurse, there's two main things that you need to think of. Now, hopefully you're thinking in your mind what those things are, but those things are ABCs and Maslow's hierarchy of needs. All right, what Maslow's hierarchy of needs is basically is it's a pyramid. You've probably seen the pyramid, and it starts out with, basic physiological needs at the bottom, and it goes up to like self-actualization at the very top. And as we work up that's kind of, the most basic things that we need are these physiological things, these ABCs. Okay, so that's where the ABCs fit in there. And when we say ABCs, what am I talking about? I'm talking about airway, breathing, and circulation. And then when we say ABCs, there's a little S at the end when you write it down. That S, you can refer to that as safety. So airway, breathing, circulation, and safety. All right, those are the 4 most important things to our patient, and they're important in that order. Airway becomes before breathing, breathing becomes before circulation, and circulation comes before safety. Okay, then after that, we're going to think about our patient's pain, our patient's education, our patient's feelings. Now, we obviously care about how our patient feels. Okay, but if our patient is feeling a little bit depressed or a little bit stressed, but at the same time, their blood pressure is tanking to 20/10, okay, that circulation issue becomes much more important. Now, we want to educate our patients. We want to teach our patients. But if our patient is having a pain 10 out of 10, we're not going to have any sort of effective teaching, okay? So again, that goes airway, breathing, circulation, safety, then pain, education, and feelings. Okay, and whatever, if we refer to test taking or working on the floor, whatever option, whatever patient care, whatever plan you need to implement that becomes closest to airway, is the most important thing. That's what you need to do first. All right, so how do we identify airway problems? How do we identify breathing problems? How do we identify circulation problems? All right, so ABCs, right? Airway, breathing, circulation, and safety. Some ways to identify airway problems. If you're reading an NCLEX question, some ways to identify airway problems are going to be things like if this patient is NPO, or testing for a gag reflex, their breathing, drinking water after surgery, dysphagia after stroke, or flat out saying there's an airway problem. So if you identify any of those problems in your patient, or you identify any of those words in a nursing question, an NCLEX question, you know you're dealing with an airway problem. How do you identify a breathing problem? Breathing problems are going to come out in things like breath sounds, O2 administration, pulse ox, raising the head of bed, and incentive spirometry. That's how you're going to identify a breathing issue. Now, circulation. Circulation can be a little bit tricky. Obviously, the obvious things are going to be like heart rate, blood pressure, CPR, but then also fluid status. Does a patient have a fluid volume deficit, or are they fluid overloaded? Okay, what's other ways that a patient can lose fluid? Another way is diarrhea. All right, another way to think of it is like hemorrhage. If a patient's hemorrhaging after surgery, or if an OB patient after giving birth starts hemorrhaging, that's going to be a circulation issue. Another one's going to be like testing pulses, IV fluids. Is a patient getting TPN or their central lines? Those are all things that are going to help you identify that you're dealing with a circulation problem. Then our safety, okay? Two categories of safety here. We can talk physical safety and we can talk infection safety. So a physical safety problem would be things like rugs for a dementia patient or an immobile patient, rugs, night lights, phone, falling, walking after taking a narcotic. You don't want to give your patient a bunch of morphine and take them on a walk or let them walk outside. And then we deal with infection problems. So things like assessing for an infection, a patient's temperature. If a patient has a temp of 101, we're starting to think that this could be a safety issue. Hand hygiene, running cultures, a patient who's on antibiotics, and wound drainage. Those are all signs of infection or assessment of infection. So that's when you're really going to be thinking this is the S in our ABCs. Now, how do you identify that a question is actually asking you about a priority question? How do you know it's that priority question? Okay, how do you know to switch your mind into the ABC gear and think Maslow's hierarchy of needs and think all this stuff? Well, some keywords you're going to find in a question that is asking about priorities. You're going to see things like priority. Which of these patients is a priority? Or what should the nurse's priority be? You might also see things like an emergency. So you're in the emergency room, or a patient comes in off an ambulance, okay? Or a patient is returning to the floor after surgery, right? That's another priority issue. You might also see the question say something like, which is the most important? A very common one is if you see the question say, which of these patients should the nurse see first? That's probably the most common one. Which patient should the nurse see first? Then you might also see, should the nurse notify the physician? Something about notifying the physician. Okay, so those are kind of key words that are going to clue you in to the fact that you're dealing with a priority question. All right, you guys, so what I really want you to take from this, okay, a couple things I want you to take from this. First of all, when we talk ABCs, we're talking airway, breathing, circulation, and safety. Whatever option is closest to airway is your correct answer. Okay. Now, after safety, after airway, breathing, circulation, and safety, we're going to deal with pain. Then we're going to deal with education. Then we're going to deal with feelings. So if you have a purely psychosocial question, you need to really use your critical thinking, your nursing judgment, and determine which option is most important for the patient psychosocially. However, if you have a patient who's in pain and you have a patient who has a psychosocial issue, you deal with the pain first. Now, not every question is going to be blatantly obvious, like you have a patient who stopped breathing and you have a patient who's a little upset about lunch. You know, that's an obvious one. You throw out the lunch one, right, and you're dealing with a patient who's not breathing. But this is a really important skill to learn, and it's not just important for test taking, it's important when you're working on the floor. I remember working in the ICU and precepting nursing students and new nurses. I remember one night we got a patient, it was a pretty basic patient, came in with a COPD exacerbation, bring the patient in, and we start going through our whole thing of assessing, getting the patient all set up, and it should have been really basic. We keep them for a little bit in the ICU, put them on a CPAP, get their ABG good, send them over to med-surg. But with this patient, it was very clear that they were not responding, right? It was going down. They were starting to become less responsive. We run some ABGs, we assess their lung sounds, we assess their neurostatus. They're just not responding. Being a critically thinking nurse and looking at your airways, breathing, and circulation, this patient their neurostatus is declining because their airway is affected. Right, so what we ended up having to do with this patient specifically is we had to end up intubating this patient, correcting their blood gas, correcting their respiratory status, correcting that airway, correcting that breathing. And then we were able to pull them off of that, get them onto CPAP, get them onto BiPAP, get them onto oxygen, and take care of them. What you need to do is you need to realize that every patient is unique, every patient is different, And you need to use these frameworks to help guide what you do, guide how you answer nursing questions, and guide how you practice as a nurse. That's what I want you to take from this. This was kind of a quick run through. On Tuesday night, February 7th, I'm going to be giving you 11 tips. This is one of the 11 that I'm going to give you. I'm also going to give you a nice PDF handout that's going to help you put all these 11 things straight and kind of give you a framework for working through nursing questions. So I'd really love to have you there. If you can make it, please sign up. Please sign up anyway. If you're not sure if you can make it, because I'll send out a couple emails before to remind you that it's about to happen so that you're able to be there if you can. If you can't, no worries. But we'd really love to have you there. You can sign up for that at nrsng.com/webinar01. nrsng.com/webinar01. You guys, we love you. We're so grateful for you. We are here to help you. We are here to make your nursing journey a success. All right, to make your nursing journey a little bit less frustrating. And we want to support you guys. So thank you so much for being part of this family. Find us on social media at NRSNG. You guys, we'll talk to you soon. You know what time it is now. It's time to go out and be your best self today. Happy nursing.